Thank you, sir, for being part of the summit and sending a positive note to all our stakeholders. India is taking all the essential steps to combat this pandemic, and our leaders are taking all the precautions and leaving no stones unturned to contain the deadly virus from spreading further. But one of the greatest digital innovation during the COVID-19 crisis is Arogya Setu app, which is helping government to identify potential hotspots in the country. To talk about this more, we are joined by Honorable Minister of Health and Family Welfare, Government of India, Shriman Dr. Vardhan, sir. Thank you, sir, for joining us. Now you may proceed, sir.
I feel indeed honored today to have been invited to address the National Governance Virtual Summit organized by the prestigious economic daily, the Economic Times. To say the least, these are exceptional times when the world is facing an unprecedented challenge. We are all in the throes of a global crisis. In just the last 6 months, the world order has changed and the change is here to stay. The novel coronavirus pandemic has impacted everything and shall leave its imprint on governance and on polity too. As a transboundary crisis, COVID 19 represents a significant challenge to public leaders, bureaucrats, and policy advisors who are expected to take decisive action, handle overwhelming amounts of data, make critical decisions regarding resource allocation, and coordinate with all stakeholders. In the current context, governance is being further complicated by the ambiguous nature of rapidly changing events, which can make the links between cause and consequence unclear. According to me, as far as continuity of public service is concerned, which is the theme of the program today, timely response is of essence. It marks the difference between containing a crisis and allowing it to spill over and overwhelm the government's ability to function effectively. A high level of preparedness is required, and despite that, unplanned consequences may occur, requiring a degree of improvisation beyond the standard capacity of even the most skilled politicians and bureaucrats. No easy answers exist, and it will be a while before we can comprehensively evaluate and compare the crisis governance strategies of individual countries. On today's subject, I could probably talk about some best practices on crisis management and governance that I myself followed in recent months, and those may provide some useful lessons to our audience here. First of all, effective communication has been a key pillar of crisis governance in the last 6 months. We have tried to build rapidly on the existing dissemination networks of public health communication. As a government, we had to scramble to contain the crisis while simultaneously communicating with the public in real time. Communicating under conditions of uncertainty was characterized by constant tensions and dilemmas. One major communication dilemma has been, do we give transparency or focus on expressing optimism and reassurance? Do we share highly technical information and aim to explain epidemiological dynamics in layman terms? Or do we construct frames and narratives that are easy to understand? Being transparent and accurate in relaying information, preparing the public for what is coming next, and expressing a degree of empathy in communicating policies has gone a long way in ensuring effective crisis communication. I feel that we have succeeded. Second point that I would like to make is about adopting an all inclusive community approach, which is of particular importance in such a crisis. And I have tried my best to engage with all types of communities, professionals, and civic bodies to ensure that there is destigmatization of this disease. I tried to make citizens a part of the solution process and got them to actively participate in containment measures, including social distancing, self quarantining, and community support for government guidelines. For this, I myself have done more than 100 video conferences, and the government as a whole must have done 10 times that number. Implementing three successive lockdowns was not easy. Our government engaged all communities across the board to ensure that people understood and participated in a major national initiative. On the governance side, it required the charisma of Prime Minister Shri Narendra Modi ji to engage all stakeholders, and they followed government guidelines meticulously with unparalleled discipline and trust. This, to my mind, is a premium example of continuity of public service with perfection. All law and order initiatives by the government enjoyed full support of civil society, the private sector, media, and others. After the lockdowns ended, we went into the next planning stage of governance, where we ensured that our economy doesn't come to a complete stop. Now we are in the phase where we are trying to normalize the situation, but in a phased manner. Third, as a student of science and being a doctor myself, I believe in implementing evidence based strategies based on historical as well as current data. Strategies rooted in validated evidence ensure the optimal use of resources and help to design probable scenarios. That brings swiftness in governance and high probability of success. The Department of Science and Technology, the Department of Biotechnology, all laboratories under CSIR as well as ICMR are working round the clock to bring scientific solutions for the pandemic, be it medicines or medical devices or vaccines or simple procedure of detection and surveillance. India has become a leader in many new and innovative solutions. We are also partnering with research labs and institutes on a global scale to adopt sound measures that reduce the threat of unintended consequences. While COVID 19 continues to represent a significant threat even today, every crisis also presents opportunities for sustained innovation and learning. How successfully this crisis is managed and how well we maintain continuity in public service will depend on how well each government is able to face it head on and bring society on board while coordinating effectively with stakeholders. Social systems are by nature adaptive, and this crisis presents a learning opportunity for all of us. This is a test for our governance systems, and it is safe to say our collective response will shape the future for years to come. A major plus right now for India is the strong will shown by Prime Minister Shri Narendra Modi ji. His drive and his dynamic guidance has led to a balanced and agile response across the country's 730 districts. I thank you all for giving me this opportunity to place my thoughts before you. I am confident that collectively we shall overcome these hard times. A part of the battle against the virus is also being fought mentally by each one of us. These are times that require society to stand together and ensure deep compassion and goodwill for those who are fighting like frontline heroes to save us. I end my address with a salute to all those who are facing the ground level brunt of the disease, and my apologies to those of our citizens who have faced hardships in finding medical help and solace. I thank you all.